This protocol addresses the issue of patient education in the current online era. Although modern life implements web-based solutions at high pace, patient education is lagging behind. Computer-based education, which empowers patients in time, place and pace of learning, has shown a positive impact on patient satisfaction, with several operational benefits. Demonstrating the procedure will be Kirill Pavlov, a gastroenterology resident from my department. He will perform the role of a patient undergoing computer-based education, illustrating every step of the process.
All referred patients for colonoscopy are asked to participate in the trial and reasons for refusal are recorded. Inclusion criteria are adult age and referral for complete colonoscopy. Exclusion criteria are Dutch illiteracy, audiovisual handicaps or mental disabilities, and no peers with internet access. Patients are randomized to the intervention, computer-based education, or control nurse counseling group per center after obtaining permission. After the patient is educated, baseline questionnaires are filled out. At the day of their colonoscopy, patient and endoscopist fill out questionnaires at several time points, before, during, and after colonoscopy. We will now show in detail the intervention in our trial. Have the patient read the pop-up with instructions on how to use the CBE and click on the Explanation of Colonoscopy Procedure tab. Have the patient read